A 59-year-old male patient had to be examined for his diabetic foot ulcer. It was found that the ulcer had penetrated the subcutaneous tissue, extending into the subcutaneous fat and fascia up to the bone with osteomyelitis present. What is the most appropriate objective measure of the wound? A. Measure the depth and shape of the ulcer and classify it as a grade 2 ulcer on the Wagner ulcer grade classification system. B. Measure the depth and shape of the ulcer and classify it as a grade 4 ulcer on the Wagner ulcer grade classification system. C. Measure the depth and shape of the ulcer and classify it as a grade 3 ulcer on the Wagner ulcer grade classification system. D. Measure the depth and shape of the ulcer and classify it as a grade 5 ulcer on the Wagner ulcer grade classification system. And the answer is D. Measure the depth and shape of the ulcer and classify it as a grade 5 ulcer on the Wagner ulcer grade classification system. Explanation for this question is: the Wagner ulcer grade classification system is a widely used tool for assessing the severity and depth of diabetic foot ulcers. It grades the ulcers from 0 to 5, with higher grades indicating more severe and deeper ulceration. In this case, the diabetic foot ulcer has the following characteristics. It has penetrated the subcutaneous tissue, it has extended into the subcutaneous fat and fascia. It has reached up to the bone, osteomyelitis, bone infection, is present. These features match the criteria for a grade 5 ulcer according to the Wagner classification, which is defined as grade 5. Full thickness ulcer with extensive gangrene of the entire foot or unsalvageable gangrene of a portion of the foot. Osteomyelitis is usually present. The key points that indicate a grade 5 classification are: 1. The ulcer extends all the way to the bone. 2. Osteomyelitis, bone infection, is specifically mentioned as being present. Osteomyelitis is a severe complication of diabetic foot ulcers and is one of the defining features of a grade 5 ulcer in the Wagner system. The other grades are ruled out because grade 4 involves gangrene but does not necessarily involve osteomyelitis. Grade 3 involves deep ulcers but only to the tendon, muscle level, not to the bone. Grade 2 involves ulcers extending only into the subcutaneous tissue.